Hello, in this module we will be discussing the topic of blood pressure. Disclaimer: all content and information in this video is for informational and educational purposes only. It does not represent the views of OUHCOM and does not establish any kind of educational mentor-client relationship. So, what is blood pressure? Blood pressure is a measure of how hard your heart is working to pump blood to your body. It is important because it is an indication of your overall heart health. Your doctor measures your blood pressure at each visit in order to check the health of your heart. To begin, let's discuss the anatomy of your heart and how it works. The heart is a large muscle on the left side of your chest. Its main job is to pump blood to your lungs and body. This is important because blood carries oxygen and nutrients that your body needs to function. The heart works in two phases. Systole is when the heart is actively pumping out blood. Diastole is when the heart is relaxing. These phases happen very quickly, within seconds, to keep the blood moving through your body. Let's use an analogy to understand the heart's two phases. Systole is the phase when the heart is pumping out blood. You can think of it like when you turn on a garden hose and water is pumped out of it. Next is diastole. This is the phase when the heart is relaxed. You can think of this as when you turn off your garden hose and no more water is being pumped through. We'll use the garden hose analogy throughout this presentation. So, what are the numbers? A blood pressure reading has two numbers. You may have seen or heard this at the doctor's office. An example of a blood pressure reading is 120/80. These numbers are measurements of the pressure in your heart during its two phases, pumping and relaxing. The top number, or in this case, 120, is called the systolic blood pressure. This is a measurement of the pressure of blood in your body when your heart is pumping or when the garden hose is turned on. The bottom number, in this case 80, is called the diastolic blood pressure. This is a measurement of the pressure of blood in your body when your heart is relaxed. Think about this as the pressure in the hose when the pump is turned off. Time for our first checkpoint. Why is blood pressure important? The answer: it is an indication of your overall heart health. This means that an abnormal measurement could alert your doctor to a new or worsening heart problem. Let's talk about taking a blood pressure measurement. Your doctor will take your blood pressure on your upper arm using an inflatable cuff. You can also do this yourself at home. Very often, the cuff is attached to a machine that automatically inflates and it provides a measurement. Many things can affect your blood pressure reading and cause it to be inaccurate. Let's discuss some tips for getting a good measurement. First, take your blood pressure when you're sitting with your feet uncrossed and flat on the floor. Next, try to be still and quiet during the measurement. Try to use the bathroom before taking the measurement. Having a full bladder can change your blood pressure reading. It is a good idea to limit caffeine and nicotine use within 30 minutes of taking your blood pressure. These substances can change your blood pressure. Sitting and relaxing for 5 minutes before taking the blood pressure is best. If you are stressed out or have just been active, your blood pressure reading could be abnormally high. If you are at the doctor's office and think that your blood pressure reading is inaccurate, it is always okay to request that this be taken again. Let's take a moment to discuss some common terms you may hear when talking about blood pressure. First, hypertension is high blood pressure. Hypotension is low blood pressure. Systolic is the top number in your blood pressure reading. Diastolic is the bottom number in your blood pressure reading. White coat hypertension, or sometimes called white coat syndrome, is when you have abnormally high blood pressure readings whenever you are in a healthcare setting like a doctor's office or hospital, but do not have high blood pressure at home. This is very common and can be associated with poor or scary experiences at the doctor's office. Let's take a moment to recap what we've learned in this module. Blood pressure is a measure of how hard your heart is working to pump the blood to your body. Blood pressure is an important measurement because it is an indication of your overall heart health. A blood pressure reading has two numbers, and these numbers are measurements of the pressure in your heart during its two phases, pumping and relaxing. Thank you for watching. We hope you enjoyed this module.